SIDS. Everyone needs to know about SIDS. SIDS is a very life-threatening, very dangerous situation. This happens mostly in infants. Everyone's supposed to know what to do and how to avoid that kind of problem in infants. What is SIDS? SIDS stand for Sudden Infant Death Syndrome. SIDS are death in infants younger than 12 months of age that occur suddenly, unexpectedly, and without any obvious cause. There is no clear explanation for the cause of SIDS, even with investigation, complete autopsy, or full complete examination of the body or the death scene. A complete clinical or social history still can't prove the cause of SIDS. SIDS is commonly called crib death. In the EKG of a SIDS patient, you will see both a prolongation of the QT interval and a shortening of the QT interval. 30 to 35% of infants who suddenly die of SIDS have prolongation of Q and QT intervals. There is also an increased risk of a cardiac dyspnea in a patient with SIDS. These dyspneas may present a syncope, seizures, or sudden cardiac death in the first week of life. There is also a presence of alveolar hypoxia that will stimulate the pulmonary vasoconstriction in patients with SIDS, and the presence of hyperplasia in the pulmonary vascular smooth muscles. The contributing factors of SIDS are prematurity and low birth rate, apnea, causes by regurgitation of gastric content with acid pH. And we have infection such as gastroenteritis, otitis media, and upper respiratory tract infection, which is a URTI, botulism, non-breastfeeding babies, maternal smoking. Cigarette smoking during pregnancy is a high risk of SIDS. And we also have a sleeping position and bedtime environment. SIDS can be prevented by avoiding the prone sleeping position and also on a soft bedding. So this is a very important, the positioning. Here are some clinical manifestations of SIDS. We have cyanosis, breastfeeding difficulty before death, abnormal limb movement in the hours before death, and also we'll see clinical manifestation of SIDS in infants that are put to bed right after breastfeeding or bottle feedings. As assessment and diagnostic of SIDS, we have lab studies such as CBC, complete blood count. We have a radiography and CT scan of the skull may be indicated if abuse is suspected or if there's a sign of intracranial pressure. Neuropathology cause of the death may also be indicated for SIDS. Medical management of SIDS. For emergency care, we need to assess ABC, airway, breathing, and circulation are the first priority. Any infant who appeared to be apneic, cyanosis, and has an alteration of mental status and tone, they need to be admitted. Make sure to inform the family in a quiet environment if the infant is pronounced dead. Refer to the child name by the name given by the family, not by baby. Be specific and direct when telling the parent that their child has died. Avoid every confusion. Use the word dead or died and be gentle in the term. To conclude, I just want to let you know it is very important to know the contributing factors of SIDS for your Nclex examination, such as premature and low birth rates, apnea, infection, non-breastfeeding infants, maternal smoking, sleeping position, and bedtime environment. Make sure to make more research about SIDS because you will need them. Thank you very much for watching. And if it's your first time here to the channel, don't forget to like and subscribe. Click on the bell notification to get notified each time I upload a video. Thank you. And don't forget to leave me a comment.